which heart failure medicine helps you survive the longest? Let me ask you something directly. If you have heart failure, do you know which of your medications actually help you live longer? Is it your water tablet? Is it the one you feel working? Or could it be one you barely notice at all? Here's the truth. There are 4 specific groups of medications that have been proven in large international clinical trials to reduce the risk of death in heart failure. Not just improve symptoms, not just reduce swelling, but reduce mortality. And if you're on all 4, the combined benefit is substantial. Modern heart failure therapy is built on what we call the 4 pillars. Think of them as 4 legs of a table. Each one adds survival protection. Pillar 1, an ARNI or ACE inhibitor or ARB. ACE inhibitors were the original breakthrough drugs in heart failure. Large trials such as Consensus and SOLVE show clear reductions in mortality compared with placebo of around 10 to 30%. They changed the natural history of heart failure. Then came the next evolution. In the landmark Paradigm heart failure trial, a newer medication called sacubitril valsartan or Entresto was what we call an ARNI, and it was compared directly against a strong ACE inhibitor. This is important. It was not compared to placebo. It was compared to a drug we already knew saved lives. And Entresto reduced cardiovascular death by about 20% compared with enalapril. So ACE inhibitors save lives. ARNI saves even more lives when tolerated well. That's why current guidelines recommend an ARNI as preferred first-line therapy in suitable patients. Pillar 2, beta blockers. These medications protect the heart from chronic adrenaline-like stress. Trials like Merit Heart Failure and CBIS-2 showed roughly a 30 to 35% reduction in mortality. They reduce sudden death and slow disease progression. They are foundational. Pillar 3, mineralocorticoid receptor antagonists or MRAs. In the RAILS study, spironolactone reduced the risk of death by around 30% in patients with severe heart failure. It blocks aldosterone, a hormone that promotes salt and water retention and cardiac scarring. This is not a small benefit, it's substantial. Eplerenone, a next-generation MRA, reduced all-cause mortality by about 24%, shown in the Ephesus trial. Pillar 4, SGLT2 inhibitors. These began as diabetes drugs, but in trials such as DAPA-HF and EMPEROR reduced, they significantly reduced heart failure hospitalizations and showed reduction in cardiovascular death. There was a 22% relative risk reduction in cardiovascular death or heart failure hospitalization combined. Note that these can improve the fluid retention in heart failure by causing an improvement of sugar and water excretion through the kidneys, so they can help you feel better. They are now considered essential therapy even in patients without diabetes. If you imagine no therapy, then add an ACE inhibitor or ARNI. You see a stepwise reduction in risk. Now add a beta blocker, add an MRA, add an SGLT2 inhibitor. Layering therapy compounds the protection. That's how we meaningfully change the outcomes. So, where does Lasix fit? Let's talk about medication that most people feel improvement with first, Lasix or furosemide. It removes excess fluid. It improves breathlessness. It reduces swelling. It is extremely important for symptom control. It has been around for decades and was part of initial treatments when we had little else to offer. It's therefore unconscionable to do a randomized placebo-controlled clinical trial to show a mortality benefit. However, what we can say is that if a patient can breathe easier and do more as a result of offloading excess water from their lungs, we know that this correlates with better survival and reduced hospitalization. Its job is different. It treats congestion, and we know that persistent congestion is associated with worse outcomes. Patients who remain fluid overloaded do worse over time. So, staying dry matters. Whilst Lasix is considered largely a symptom management drug, the 4 pillars are considered more of a set of survival protection drugs. We need both. Now, I want to say something equally important. Living longer is not only the goal. Quality of life matters. Breathing comfortably matters. Sleeping flat matters. Walking without stopping matters. Avoiding hospital matters. Sometimes symptom improvement is what allows you to exercise, stay active, eat well, and engage in your life. And those things also influence outcomes. So, heart failure treatment is not just about years of life, it's also about life in your years. If you remember one thing from this video, let it be this. Water tablets help you feel better, the 4 pillars help you live longer, and the best outcomes happen often when we use both.